to be would be anywhere my dog can run around wild. So the woods, probably. But she also likes the beach. We just went to the beach recently. So that would be my happy, calm place.
That's great. Thank you for sharing.
I'll share right quick. Ron Garrett Bridge Center at Adams House. My number one place is a cruise anywhere, and I'm overdue for one.
I'll go next. I'm Courtney Reed. I am nurse practitioner at Prince George's Health Department and at the Methadone Clinic. My happy place would have to be anywhere with music, good music, and food.
Thank you.
Good afternoon. My name is Wade McLaughlin. I am Program Director for Empowering Minds Resource Center's Targeted Case Management Program. My favorite place to vacation would be any place with water. I really enjoy swimming.
Excellent. And I see a hand raised, Nikki.
Oh, hey. Hi. Can you hear me?
Yes, hi.
Okay. Hey, everyone. I'm Nikki Greco. I'm Constituent Services Director for Council Member, District 5, Prince George's County, Jolene Ivy, and all of the above, especially water. I love going to the beach.
Excellent. It feels like we're all getting in that spring mood, summer mood, especially with the weather recently. So this is great. And I hope everybody has some time set aside this year where they can do some of these getaways or something close to it. Did anyone else want to share this morning or this afternoon? All right. And my name is Kim Stinchcomb. I am the director of the Healthcare Action Coalition and with the health department. And my favorite getaway is also just anywhere where there's live music. So I agree that that's great. And I was encouraged to do this question today because I am going on a getaway tomorrow out to California. So and I've never been. So I was just interested to see what everyone else does to kind of escape for a little bit. And thank you to everyone for sharing in person and in the chat. So like I said, today we have Ms. Campbell from the Prince George's County Health Department here to share on the Adolescent Clubhouse in Prince George's County. Sadie, did you want me to do the slides for you? Or do you want to share your screen?
Yeah, if you have it right now, yes, please.
Absolutely. 1 second and I'll pull those up for you.
Okay.
How do you get rid of that?
All right, want to confirm everyone can see the slides okay? All right, I will pass it over to you.
Okay, perfect. I'm trying to make sure that I can see. There we go. Okay, am I good to go now, Kim?
You're all set. Thank you so much.
Okay, absolutely perfect. Good afternoon, everyone. Once again, I am Ms. Campbell, and I am the recruiter for the Prince George's County Health Department Adolecent Clubhouse. All right, so as it relates to today's agenda, I'm going to elaborate on an introduction as to what I do at the Clubhouse. I'll speak on the background and history of our program, the program eligibility, the initial process, the non-clinical services that we do offer here at the Clubhouse, the evidence-based programs that we offer, the opioid crisis that's impacting our community and what we've created to assist with that, the schedule that we like to adhere to here at the Clubhouse. I'll also speak about the program goals / expectation for our youth that are enrolled, the referral and enrollment process, as well as our program contact information. So where we're located, how you can start the enrollment process, things of that nature. And at the very end, I'll leave some time if there's any questions or concern. And please feel free to stop me throughout if you have a burning question. All right, so as it relates to me, so like I mentioned initially, I am the recruiter for the program. So I do, I'm in the community doing lots of collaboration, sharing what we do at the Clubhouse so that we can increase enrollment and get our youth involved. Next slide, please. Okay, there we go. Okay, so as it relates to the background and history of our program, we are a grant-funded program. So we do receive funding from the health department to provide services to youth that are currently using substance or at risk of using substance. So I do get a lot of questions, who would we consider our at-risk youth? So our at-risk youth are basically youth that are not using substance. However, they may be socializing with a lot of peers that are. And for me, I think that all of our youth are at risk. If you are keeping up with what's happening in the school system right now, a lot of our youth are utilizing substance, and other youth that aren't using substance are still going to school. So I would also consider all of our youth are at risk. So we do provide funding for those youth. We are also a strength-based program. So we focus highly on the strength of our youth. The ultimate goal is to support and promote recovery in a way that respects the adolescent growing stages. Next slide, please. All right, so as it relates to the eligibility, so we do provide service to youth that are 12 through 17. However, we do make exception for youth that may be 19 or 20 years old. The only expectation is for them to be a resident of the county. So if those youth are seeking to get their GED, if they need assistance with getting enrolled into college, if they are seeking employment, we would provide those services for those youth. Now, as it relates to our 12 through 17 age range, we're looking for youth that may be using substance, if they are at risk of using substance, if there are concerns with their family dynamic, there are numerous absences from school, if there are some challenges occurring. However, we are also an enrichment program. So even if our youth may not have these concerns, they're also able to be a part of our program, So we are targeting youth that may have mental health concerns. And like I stated, we're also an enrichment program. So all of our youth are welcome to be a part of our program. They have to be enrolled into a PG County school, and they have to be between the 12 through 17 age range. Next slide, please. Okay, so as it relates to the initial process, so we are a non-clinical program. I know that we have Adolecent Clubhouse recovery program, but we do not offer any kind of clinical services to our youth. However, we are partnered with several substance abuse treatment centers within the county. So if we have a youth that is currently using substance and they are seeking to enroll into the Clubhouse, we highly encourage that the youth have already sought out treatment. However, if they have not sought out treatment, we still go ahead and enroll them into our program. And we are along the process throughout the entire getting them enrolled elsewhere. So we enroll them to our program, and then we refer them to one of our substance abuse treatment centers that we are partnered here, that I have listed here. And we would offer those non-clinical while they receive services elsewhere. So a few substance abuse treatment centers that we are partnered with are Fields and Fields Treatment Center. We are partnered with Volunteers of America Hope Center, College Park Family Services, and Reaching Individual Minds Successfully. So just wanted to emphasize once more, we are non-clinical. However, we do provide services to you that are currently using substance by partnering with substance abuse treatment centers so that we can provide those wraparound services. All right, next slide, please. All right, so just to elaborate on our non-clinical services, we do offer case management and advocacy. Like I stated, we get the youth enrolled, and we are along the entire process. We do offer recovery support groups, academic tutoring, if they need assistance with getting enrolled into college, GED. We provide financial literacy. We speak to our youth about the importance of peer pressure resistant, drug resistant, and a listicle of other services. We also offer field trips to our youth as well. We are an all year round program, and all of the services that we do offer are completely free. There's no cost to our parent or guardian, and there's no insurance requirement. So just wanted to emphasize that. That we are free all around. The only investment our parent or guardian and our youth are invest in is their time. We also offer limited transportation, and I stated limited specifically because it's more so on a need basis. So we have to pick up our youth throughout the county, right? Throughout the entire county. So from Accokeek, we're going to Laurel. So we like to pick up our youth more so on a need basis. So if the youth is really interested in one of our on-site programming, we definitely coordinate with our youth and their families. If they're able to transport the youth, then perhaps we can transport the youth back home. We would prefer doing it that way so that we won't impact our programming time. So just want to emphasize, we do offer transportation. However, it's more so on a need basis. We are also all year round. It's not listed here, but we are an all year round program. All of our programming are done when our youths are out of school. So everything is contingent based on their schedule. Whenever it's summertime, of course, it's more activity based. So we're doing the Six Flags, we're doing the museum, doing the picnic, we're out in the community. When they are in school, we focus more so on their mental health, making sure that we discuss, if they need assistance with getting their resume completed. We focus on more of those life skills areas. So yes, next slide, please. Okay, so as it relates to our evidence-based programming, these are a listicle of our evidence-based programming that we do offer to our youth. Evidence-based, I'm sure everyone is familiar with what that is on this call. These are programs that are basically proven to work. So we do offer Boston life skill training. That training basically has everything pertaining to life skills. So the peer pressure, the drug resistant, things of that nature within that program. We also offer our Strengthening Families program. We actually just started our first Spanish session for Strengthening Families in person. Since COVID, we've been doing virtual, and this is our second in-person session. As it relates to our Strengthening Families program, we offer an 11-week and a 7-week program. Throughout each session, we do provide meals to our families. We do so specifically to encourage family time. A lot of our families, we're going to work, the students are going to school, we come home or we drive to Chick-fil-A, everyone goes to their room, and no one really have dinner together. So that's one of our things that we like to encourage during our Strengthening Families program, is to encourage family dinners, which is also a form of bonding time. We also offer a listicle of incentives to our families. Concluding a session, we do a graduation, and then we provide our youth and families with incentives. Incentives could range from seasons pass to Six Flags for the entire family, gift card to Target gift card, Chick-fil-A gift card. Each family gets a listicle of incentives. Throughout each session, we do have separate session, one session for our youth, and then we have a family session and the youth session. Oh, the admitting sound is driving me crazy. Sorry. Yes, so in our Strengthening Families program, we do separate sessions. So in our youth session, we speak to our youth about the importance of listening to their parents, the importance of saying no, good qualities in a friend, peer pressure, drug resistant. In our parent or guardian session, we speak to our families about the importance of having house rules, making sure that we know who our youth are socializing with, making sure that we speak to our youth about avoiding substance, what it does to your brain, things of that nature. And then we come together as a family to kind of summarize what each session, what was taught in each session. And that is, like I stated, this is our first Spanish session that started yesterday. Once we do finalize when we'll be having our next session, I'll definitely share that with Kim, and perhaps Kim will be able to share that with everyone so that we can get some families interested in that. We also offer our naloxone training. Our naloxone training is offered on a monthly basis. However, we are finding it that a lot of our youth are using substance right now. I'm sorry. Thought I heard a beep. We're finding that a lot of our youth are using substance. So a lot of the youth that are coming in our program right now, they're overdosing on Percocet, they're using the marijuana, just a listicle of substances that they're using right now. So we offer this training more so on a need basis. So if we have someone that was enrolled immediately, we go ahead and provide that training immediately instead of waiting to schedule them. We go ahead and schedule that immediately. We also offer Seeking Safety training. Our Seeking Safety training is also offered on a monthly basis or more on a need basis. Within this training, we are speaking to our youth and our families about the importance of being resilient. We speak to our families about how to deal with depression, so sharing some positive coping skills, how to deal with trauma, things of that nature. We also offer our Sexual Health and Recovery, which is our SHARE program. And it's basically what it states. We speak to our youth and our families about the importance of good sexual health, right? So not necessarily a scare tactic, but we want to let our youth know that if they're going to engage in sexual activity, that they are aware of what's happening in the community. If they choose not to use protection, if they choose to do something, so we want to make sure that they're aware of STDs, the HIV. We want to make sure that they're aware of all the pregnancy, right? So those are some of the topics that we discuss in our sexual health and recovery. And last but not least, our mental health and first aid. This is one of my favorites because our mental health is correlated to all that we do. So if your mental health is not in order, you're unable to make good decision. It's very important. And like I stated, this is also offered on a monthly basis. However, if we find a client, is enrolled and there's a lot going on, we make sure we go ahead and provide that immediately. Excuse me. So these are just a few of our evidence-based programming. Next slide, please. All right, so as it relates to the opioid crisis that's impacting our community, I'm sure, once again, everyone on this call is familiar with what's happening, what's going on with fentanyl in the school system, things of that nature, the number of deaths from using fentanyl, and we know that this definitely impacts our community. Next slide, Kim, please. So what we've done here at the health department, Adolecent Clubhouse, is that we've created a prevention and intervention program specifically to improve access to recovery services and substance abuse disorder treatment. We want to make sure that we are providing educational updates for our providers as well as our youth and families. And we also want to make sure that we're broadening access to community opioids overdose prevention program. You'd be surprised. There's a list of people don't know who to call when someone is using substance or if someone is experiencing an overdose. There's quite a few people that don't necessarily know who to call or think they're going to get in trouble, for lack of better words, if they do reach out. So these are some of the things that we discuss in our naloxone training, which is offered on a monthly basis. But like I stated, if we have an enrollee that is overdosing on Percocet or any of these other substances, we want to make sure we go ahead and schedule that training immediately. Next slide, please. All right, so this brings us to the schedule. So we do like to adhere to a schedule here at the clubhouse. Our youths are expected to participate in at least 2 out of our 4 weekly programming, which includes their individual checking. So this is just an example of what a schedule would look like. However, this could certainly change based on the availability of our youths and their families and the caseworker. So on a Monday, we'll do an individual check-in with our youths, make sure that we find out what's happening in school, if they need any additional support, provide them with our calendar or anything else that we have going on here at the clubhouse or anything else that may be, burning that they need to discuss with their caseworker. On a Tuesday, we'll do a BOT-VIN life skill program. On a Wednesday, we'll do a recovery support group. On a Thursday, we will do anything pertaining to getting employment, college readiness, academic tutoring, things of that nature. And on Fridays, we like to make things a little bit more youth friendly. So we do like to consider our program for our youths by our youth. So we do like to take in consideration what they would like to see us doing differently here at the clubhouse. So on Fridays, we've done paint night or paint day, virtual or in person. We've done a movie time at the clubhouse. We provide everything for youth for that. So anything that they find, youth friendly, that's not so rigorous for the other days, we'll like to do on a Friday. Like I stated, this is subject to change based on the caseworker and the youth and the families availability. Now, in addition to that, we do provide incentives for youth. We do this specifically to let them know that we see them, right, for showing up for themselves. Consider, and this is something that we started since COVID. We did have a decline in our youth, and I think specifically because they were going through that transition of, in person and virtual, and a lot of our youths did not favor virtual programming. So we did have a decline. However, we've started providing incentives to our youth, and those incentives could range from anything to a book about financial literacy or a gift card or anything that's age appropriate that we think that would be conducive to the youth. So those are some of the things that we do to, make sure that we encourage them and also let them know that we see them for showing up for themselves. Next slide, please. All right, so as it relates to the outcome, like I stated initially, we are a strength-based program. So the ultimate goal is to focus on their strength, their talents, their abilities, and we want to make sure that we're improving their well-being. So everything that we do is from a holistic standpoint. We want to make sure that we're looking at their family dynamic. We want to make sure that we're looking at their mental health. We want to make sure that we're looking at what's happening academically. We look at the entire child. And the ultimate goal by enrolling into the clubhouse is to make sure that we're improving all of those areas. We want to make sure that they're making good decisions when they're with or without their parent or guardian, and that when they do get older, that they're able to, contribute to society and be good citizens. If they do come into our program if they're using substance, we want to make sure that we're decreasing substance usage. We want to make sure that we're improving any kind of behavioral concerns and ultimately improve positive functioning in their lives. Next slide, please. All right, so this brings us to the referral and enrollment process. So very much like what I'm doing right now, sharing this information with the community, community advocates, therapists, local pediatrician, probation officers, counselors, teachers. Once I do share this information, I do send a follow-up email where I share a referral form. If you are familiar with the youth that could benefit from our services, you can then go ahead and complete that referral form and return it to me. Once you return it to me, my supervisor will then follow up with the family, gather any additional information. Once he does that, he then assigns the youth to a caseworker, and then the caseworker will finalize the enrollment process. Typically, our caseworker follow up as soon as they're able to, but specifically between 24 to 48 hours. Next slide, please. Okay, so this brings us to our program contact information. So I'm sure everyone is familiar with the Bright Seed Road area where the Department of Social Services, we're in close proximity, about 2 lights down. This is actually our new location. We were previously in Riverdale. If anyone on this call is ever interested in doing a tour of the clubhouse, I would be happy to conduct that. We have a beautiful facility. We have a gym for youths. There is a computer room, a music room, conference room, and we recently finalized our murals on the wall, which is just so beautiful. So if anyone is ever interested in doing a tour, please feel free to shoot me an email. And I've also listed the specific address here, our phone number. And like I stated initially, our hours are contingent based upon school hours. We are an all year round program. However, all of our programming are done when our youths are out of school. So the half a day we may pick them up from school and then do something, maybe watch a movie at the clubhouse. During the summertime, we're more in the community, more activity based. When they're in school, we do our program around 5:30, or based on the family availability. So just wanted to emphasize that we are all year round. However, our hours are contingent based upon school schedule. And our services are hybrid currently. So based on the programming, it's either virtual or in person. And once again, based on our family's availability. I've also listed the referral email, excuse me. I am responsible for checking this email alongside one of my other colleagues. However, if you do have a youth that is interested in getting enrolled into a program or you think could benefit from the clubhouse, I always suggest sending that referral directly to me. I've also listed my email here as well. And I will do a follow-up email, Kim. I will send that information to you. And if you're, able to send it out to everyone, that would be wonderful. And I've also listed the website as well, and I'll share the follow-up email will also have the website. On the website, it gives all the information that I'm going over regarding to the clubhouse, and it also has our referral form. So it's also accessible there if you're never able to get a hold of me, which is very rare. But yes, just wanted to emphasize that. Next slide, please. Oh, this brings us to the end. Okay, so just want to thank everyone for allowing me the opportunity to share what we do here at the Prince George's County Health Department Adolecent Clubhouse. I am looking forward to collaborating with everyone on this call, get some youth enrolled, and see how we can do any workshop or do any form of collaboration. And now the floor is open for any questions or concerns.
All right, I see a hand raised, Larry Yep.
Oh, yes. Thank you so much for your presentation, and thank you for mentioning the fentanyl crisis in the schools. And, I've noticed over the last several months, it seems to be, quite an uptick in numerous counties in Maryland. And I just wondered if you felt from your vantage point, the kids involved with fentanyl were being successfully connected with service providers like yourself who specialize in substance abuse.
Yeah, absolutely. Absolutely. Thank you for that question. So yes, I'm not sure if anyone on this call was a part of the, there was we had a Zoom meeting with Mr. Richard Moody and PGCPS where we spoke on what's happened in the county and how we can assist with that. So I know Mr. Richard Moody specifically has a task force that is going throughout the county, going to all schools to assist with the fentanyl crisis that's occurring right now. And as it relates to me being here at the clubhouse, that is something that I do on a daily basis. So connecting with the school. So I'm reaching out to the counselors. I'm going in person for the workshop. I'm having, workshops specifically geared to talk to the youth about what fentanyl and other substances are doing to their brain, their body, their decision-making skills, things of that nature. So yes, I am in the school system, whether virtual or in person, to make sure that we get some youth enrolled into our program and we decrease or eliminate their substance usage. So hopefully that answers the question.
I also see Dr. Wiggum has a hand up.
You're muted, Dr. Wiggum.
Thank you. I always do that. Always trying to block the background noise. Ms. Campbell, I just wanted to ask you, what is your program capacity?
Okay, so we do have a number of caseworker, and each caseworker caseload. So right now we do not have a standard, okay, we're not going to enroll any youth. At this moment, we do have a number of caseworkers, so their new enrollees are assigned based on the caseworker caseload. So say, for instance, we have one caseworker that has 20 youth on their caseload and another caseworker has 10. We would then go ahead and assign the youth on that basis, if that makes any sense. So at this moment, we do not have a standard cap as it relates to the number of youths that are on each caseload or where we say, okay, no more enrollees at this moment.
Okay, thank you.
You're welcome.
Ms. Campbell, I have a quick question. If someone that's involved with the program wants to bring like a peer to one of the events that you're holding, do they all need to be formally registered or can they bring people along?
Oh, that's a great question. And specifically because right now, and yes, my short answer to your question is yes. We do welcome youth that are enrolled to bring along a youth to enter any of our programming. Of course, that has to be something that has to be discussed directly with the caseworker, notify the caseworker, ask the caseworker, but from a standard clubhouse rule, yes, that is allowed. And I'm going to use an example. Right now, we have our Strengthening Families program. One of our youth, she is enrolled into our program. However, her friend is not enrolled. We're working through the process of getting her friend enrolled, but she's able to be a part of our Strengthening Families program despite being enrolled. So yes, to your question, Kim.
Thank you.
You're
And
so welcome.
I was also curious if you all have at this point, well, do you collect any baseline data to kind of do an assessment of changes to mental health or enrollees' opinions on substance use?
Yeah, absolutely. So yes, success is something that we like to measure highly here at the clubhouse. So any program that we're conducting, we do provide surveys, and we do take in consideration, comments or replies from our families and or youth. So yes, we do provide our youth and families, concluding any of our programming, to receive surveys and put their consideration into consideration. So yes.
Thank you.
So
Does anyone else have questions?
I think if
Oh,
I'm
yes,
saying her
I
name
see.
correctly. Okay.
Ms. Greco?
You're muted.
Okay. Yep.
Yeah.
Yep. Can you hear me now?
Yes.
Yes.
This is fantastic. When was this initiated?
Okay, yeah. And I always get that reaction. Oh my goodness, where have the clubhouse been? Where I always get that in person or virtual. And the good thing about our program is that everything that we offer is free, like I stated. But we've been around since I want to say 2014, if I'm not mistaken. And I'm fairly new to the clubhouse. It's been about a year.
Right,
A
because you
year, a
just
little over a
graduated.
year. Yes, exactly. I just made it to the team. So yes, we've been around for quite some time. I know one of the aspects that we didn't have at the clubhouse was an outreach person. So that's where my focus is. All of my other colleagues mainly work directly with our youth. So, doing those caseworker duties, and I was brought to the team to deal with anything regarding to dealing with counselors, the probation officer, making sure that everyone in the community is aware of our program so that we can go ahead and make some differences.
I have two other questions, and
Yes.
they are quick. So this is Prince George's County funded, isn't it?
Health department, yes, it is.
Oh,
Yes,
good.
all
Okay,
of our
good.
funding, yes.
You're in our district. You're in the District 5 of Councilmember Jolene Ivy. So we
Yes.
represent you as well. So please
Okay.
remember, you may have spoken to she or her chief of staff
Yes.
since. This is new for me to learn, but
Okay.
but remember that we're here to represent you as well. So
Okay.
you're the outreach individual. Well, I'm the one that you'll connect with if you need any further assistance in the for county needs. And
Yes.
with it,
Okay.
are you all aware of NAMI, National Alliance on Mental Illness for Prince George's County, our Prince George's County chapter?
Yes, absolutely. I can't think of their names right now, but I've done presentations with NAMI. I do share information to NAMI, and they also share information with me that our youth and family can benefit from. So yes,
Right.
I'm very familiar with NAMI.
Good. Well, Mental Health Month is coming up in May.
I know,
and
in May.
the big walk is going to be in Baltimore, but Prince George's is going to have their own NAMI walk on May 6th. So I'll make sure I send
Really?
you information about that too. It's
Oh
going
my
to be at the
God.
Bladensburg Harbor.
Okay. I would love to be a part of that. If my memory serves me correctly, I will be at another mental health event on that Saturday.
That's
And it's funny
okay.
because there's so many events on May 6th, but please keep me abreast of anything additional, and I will definitely reach out to you. I don't know if you're able to maybe share your information in the chat, and I'll definitely reach out to, further discuss so that we can collaborate.
So and give me the beginning of your email.
Sure. It's SK Campbell.
I have it. Okay.
Okay,
And
perfect.
yeah, we're in the
Thank
global
you.
address. Thank you.
You're so welcome.
Thanks, Kim.
Thank you. This has been a great presentation. Thanks so much, Ms. Campbell. Does anyone else have any additional questions? All right. Well, thank you again. This is really valuable information. This is great work, and we really appreciate you sharing it today.
Absolutely. Thank you so much, Kim. And like I stated, I will be sending the slide if I haven't already done so. I will also do a follow-up email with Kim, and then Kim, will be able to share that with everyone else so that everyone has my contact information and everyone can bombard me with workshops and outreach events. Thank you. Thank you once again, Kim.
Thanks so much. All right, bear with me for 1 second. I'm just going to switch back to the other slides. All right. So, as you all know, very likely know, as part of the Behavioral Health Advisory Group, we are also encouraged to take on goals and strategies to help improve the county. Right now, just coming out of COVID, we're very much focused on just community building and making sure that we all have connections with each other, that we're aware of the resources that are going on so that we can build and enhance them and identify any gaps to make additional changes. So I just wanted to take a few minutes today to share some of the previous goals that we had within the Behavioral Health Advisory Group that obviously I started with in this role in December. So these goals predate me in this work. So I'm kind of going off of historical information that was provided, but so I encourage this to be a completely open discussion. If anyone has feedback or has updates around where these strategies were. However, as I walk through some of these goals, I just want you all to start thinking about what do you think are some of the most important areas that need to be addressed in mental health in the county, and where do you think we could go moving forward? And this could be anything, and it doesn't have to be. I think our long-term goal will be to review a lot of our ideas and strategies and do some prioritization on what we want our next steps to be as a coalition. So this is a list of the previous behavioral health work group goals. We had promote the integration of behavioral health and somatic care among providers, community programs, and schools, support the behavioral health needs of justice-involved individuals, support emerging behavioral health needs, and increase utilization of health benefits. So within each of these goals, we had a few strategies. So for the first goal, some of our strategies were to host at least 2 learning sessions to promote comprehensive health for both primary care and mental health providers, develop a behavioral health advisory group partner directory, provide tools to facilitate partnerships among behavioral health, somatic care, and health management technology organizations, to implement integration model in Prince George's County, and then provide tools to facilitate partnerships among behavioral health, somatic care, and health management technology organizations. So I feel like the overall takeaway from this goal is just to provide opportunities for integrated health and have more visibility of the services that are available. Does anyone have any additional feedback for this goal as it stands? Do you feel that there's additional work to be done? Or should we continue to kind of consider this as a high priority area? And I can add, so I definitely think there's room to continue building these partnerships. I think that, it will just be, what does that mean for us? And does that mean just making sure that we continue having these speaker sessions where we can really promote programs within the county? I think that, this is really proven to be a good tool to get the word out, just having this opportunity for speakers to come in. So hearing nothing on this goal, I'll go ahead and move to the next goal. So this one, support the behavioral health needs of justice-involved individuals. Some of the previous strategies around this were development of a re-entry toolkit, improve service quality among community-based programs by providing high-quality training on evidence-based practices and re-entry. A website, a list of community-based programs that provide evidence-based practices. I do want to take a minute. So I was able to touch base with Mr. Guy Merritt, who was the previous behavioral health co-chair, and discuss some of these previous goals. His advice and encouragement was that we might want to move away from creation of lists. And I think that a directory is great and somewhere that people can go to look for information is perfect, but how do we make sure that that type of work is sustainable and updated? Because I think that, we can have a list of providers, but if all of the numbers are no longer working, it can just add to the frustration of the process. So I think that as a group, an online directory is fine, but how do we make sure that we're building resources that are sustainable?
So may I please chime in when it comes to that listing on the website? Those are actually individuals. That website is maintained by the Bridge Center at Adams House, and those are the people that have been vetted and signed a memorandum of understanding with the Bridge Center Adams House. Those are the individuals that they plan on listing on their directory.
Okay, perfect. So that you're speaking to the list on the website. Do you have a link to that website?
Dr. Garrett might. I don't.
And what Ms. Kokonam is referring to is this is specifically around community-based partners of the Bridge Center Adams House that provide services to returning citizens, veterans, and transitional age youth. And it is still a work in process. It is not a live site at this time, or a live component of our website at this time, but it will be.
Okay.
Yeah.
Thank you so much for the update on that. Okay, so it's still in works. Is there anything that is needed for support at this point?
Not really at this time. As I said, we're still, gathering, because we don't want to include anyone that doesn't have a ratified MOU. That's kind of been the Achilles heel in the process. And so now that we are beginning to get those approved and finalized, we're able to begin working on the directory for the website.
Okay, thank you so much for that update. All right, I think that brings us down to, I think we're around strategy 6, supporting the creation of sequential intercept model map to detail how individuals with mental and substance use disorders come into contact with and move through the criminal justice system. Does anyone have updates on this strategy?
So this is Elizabeth again. Out of that sequential intercept model conference we had, birth the assessment and education subgroup, which basically I feel like that's what we're discussing here in goal 2. What we've done, I'm thinking that we're doing it with that subcommittee and merging it with behavioral health, BHAG, as opposed to having it, and that subgroup is actually goal 2. So and the goals we're working on is strategy 1, 2, 3, and 4. So I'm believing that number 6 is what we broke down to strategy 1, 2, 3, 4. So
okay.
that could be deleted.
Okay, got it. And yeah, I think that is marked completed on the website. Perfect. Okay, and just so I know, I haven't had any Is the assessment and education group still meeting? I don't have any of those invitations formally, or maybe we can work together to make sure that I'm aware.
So when we had the last meeting with Nia, prior to her leaving, I believe we actually no, with Leah, Di, and I can't remember his name, prior to him leaving, I believe we decided to figure out what we want to do. Do we want to continue to have this subgroup, or do we want to merge with BHAG as opposed to having two separate meetings? Because it seems like we're working on similar goals and we're reporting out to BHAG, and it's almost redundant. So,
Okay.
yeah.
That sounds great to me. If there's ever a time that you want to take the lead and focus specifically, no, I mean that, and focus specifically on some of those goals. That way they're not, getting overlooked. But I think that will be kind of part of our work moving forward, is just kind of making sure that we stay on track with some of the strategies, or just redefining them.
Okay.
Thank you.
You're welcome.
All right. Goal 3, it's a little bit shorter. Facilitating connections to volunteer opportunities. So these are really focused around the COVID-19 pandemic, facilitating connections to behavioral health telehealth providers. It was just making sure that people continue to have access. How does everyone feel about this goal in its current status? So I know that the COVID emergency declaration is ending in May. I know many providers are starting to reopen, but many others may have found that a virtual relationship works great for them. Okay, that's okay if we don't have thoughts on this at this time. And then lastly is just development of promotional material to educate community-based organization about Medicaid behavioral health services. Does anyone have information that they would like to speak to about this educational materials and promotional materials? Okay, so that might be one that we can revisit as well. I want to take a couple minutes to allow anyone to have feedback around what do you think are some of our biggest behavioral health priorities? And I can start the conversation by saying that I know it can be very broad. And yep, then I will let Larry go ahead and chime in before I do. Go ahead, Larry.
Oh, no, I didn't mean to, bypass. I guess one of the things I know we've been looking at Shepherd Pratt, we've been very concerned about the uptick in gun violence among youth that followed the pandemic. And, we've been doing a number of trainings around it. But I mean, I feel like there's a deeper mental health issue that's driving it. And you turn on the news and it's like almost every day there's some youth or young adult involved gun violence. And I can't help but think it's not mental health related. And of course, it's related to the disproportionate number of guns, unfortunately, in our society. But I just wanted to throw that out because it just seems so constant today. So.
Thank you for sharing that. I absolutely agree. I do know that our new DCAO, Dr. Ariola, youth violence is definitely high on his list of priorities. So I'm hopeful that we'll be able to do some activities to, find out best practices or what we can do to dive into that information a little bit more. And I'm pretty sure that some of our epidemiologists within the health department are pulling data as we speak. Does anyone else have comments around that topic? And any feedback about other priorities that you might have? Okay, and this is fine. We can continue to keep this discussion going. I think over the next month, maybe just as an idea comes up, or you have a moment where you see some data that are particularly shocking, or something happens that you want to address, please feel free to reach out or bring it up in the next meeting. We'll continue to compile different areas of importance that we can work on developing strategies for this team to work on.
Can I? Oh, this is Elizabeth. Let me share one of the things that has been on my mind, and I'm not sure that BHAG is the place to discuss it, but since we're talking about health care, so of course I work at the jail, and what I found is that some of the individuals that we have that have some severe medical conditions, and we're trying to get to a facility, maybe a long-term care facility, it's been very difficult to move them from a bed within the jail to a bed in the community. I'm just wondering how we can bridge that gap, so we could do a bed for bed, understanding that they're coming from a correctional facility, but these individuals are severely ill and they need assistance more than we could do within the jail. I'm just wondering what we could do to navigate that system. So that's one thing that's on my mind.
That is, I know, such a huge issue. I think that this is a perfect place to have this discussion because I think it's very complicated, but also very important. I know I talked to Renee Enzer-Pope from Department of Social Services recently, and she also highlighted how, this cycle of, correctional facility to bypassing long-term care, not having available housing, back to correctional or their shelters is very difficult to work through, and that we don't have available long-term care, and that assisted living facilities can be too expensive or not accessible to people coming out of the facility. So if anyone has something that they want to add to this conversation, this is very casual at this point, but I think that, this is the right place for us to have it. I do know, maybe I can work with someone from Department of Social Services to come in, and I think it's on their to-do list to start really mapping that process. So I don't know if they're working directly with Department of Corrections for that, but maybe we can start building up that conversation a little bit more.
Definitely. Thanks.
Thanks for bringing that up.
You're welcome.
All right. I can move us into community announcements. This Saturday is National Prescription Take Back Day. There's additional details on the DEA website and resources to promote National Take Back Day, but does anyone aware of any local activities that we have going on around Prescription Drug Take Back Day?
I know that Bowie is doing a take back at the police department. I think it's over by the Bowie Mall area. And I think it's something like 8:30 to maybe 2 or 3 o'clock, something like that.
Thanks, Dr. Wiggum. Maybe I can follow up on the police website to see if they have additional information. We also have, the coalition now has a new community calendar on our website, where we can add all of the information about our meetings, but also partners can add events as they come up and they want to promote them with the community or any of our partners. So I will put a link to that calendar in the chat. And I encourage everyone to add your events as they come up. And then finally, I also wanted to promote the greatest of all time Youth Mental Health Expo, which is coming up on Saturday, April 29th. There's registration information available in the slides if you're not registered already. I think that this is expected to be a really great event for youth in honor of Mental Health Awareness Month in May. Does anyone else have community events or updates that they want to share?
I'm going to throw Dr. Garrett out there to talk about Second Chance Awareness Month activities. There's an activity at Prince George's Community College also on the 29th for returning citizens.
So the primary ones that you may want to share with your network would be there's a job and resource fair coming up at Cedar Heights Community Center this Saturday from 10 to 1. And then on the 29th will be the Prince George's County Reentry Summit. That'll be held at Prince George Community College from 9 to 2. All right, and I can share those flyers with you to maybe distribute to everybody else.
That would be really helpful. Thank you so much. Announcements from anyone else? All right. We have our next work group meeting is scheduled for May 17th. And I also wanted to put a save the date out there for the next coalition quarterly meeting, which will be in person Tuesday, June 17th from 6 to 7:30 at the Park and Recreation Administrative Building on Kenilworth Avenue. With that, I hope you all enjoy the rest of your day. Thank you so much for joining. And again, special thanks to Ms. Campbell from the Adolescent Clubhouse. I think we all learned a lot.
Thank you.
Thanks so much. Talk to you all
Thank
soon.
you. Bye now.
Good afternoon, everyone.